Okay, so today we're going to go through a standard ankle strapping technique. You could choose to use the premium 38mm strap-it tape or the professional 38mm strap-it tape, and we'll show some fix-it hypoallergenic tape as an underwrap as well. Okay, so with this technique we're going to use the strap-it professional 38mm rigid tape, and what we start off with is a couple of basic anchors. Okay, so we go around the lower part of the leg, so not too high because then you restrict the main muscle, so there's less muscle bulk here, so we can apply our anchors in this area here. So you can use one or you can use two depending on the size of your athlete's leg. Okay, so what we generally do after these anchors is we pull the tape and we apply a couple of stirrups. And so here's the bumpy bit on the inside of the ankle, so generally I apply that just on top and just behind that. And you start on the inside of the ankle and you move your tape around to the outside. You can rip it before you apply it, and just a bit of light tension, so not too hard, you apply the tape. And you do that again, so laying the tape down across where you taped previously. You can tape it a little bit behind or in front, but that's the general area that we recommend. Okay, so there's two basic stirrups. And then we rip the tape again, and we can do here some sixes. Okay, so there's different variations of sixes, but what we generally do is apply the tape just a little bit further in front. Okay, so come around, and the really important thing is to use your other hand to mould the tape to the direction that you want to go. Okay, and the best way to explain this is you end where you started. Okay, and you can apply one or two of these. And you can apply more if you need to, if it's a bigger athlete. Okay, and just apply a bit of pressure there. Always use your hands to mould the tape to the joint that you're taping. Now the last one, which is a little bit trickier, is what we call a heel lock. Okay, and with the heel lock, the best way to explain it is that for the inside, the bumpy bit of the ankle, you just go just above that, and if you're looking straight down towards the floor, you just provide a small angle of about 20 degrees, okay, coming towards you, and then you mould the tape to the back of the ankle. Not too much pull around the Achilles. You can apply your pull once it's past the bottom of the foot there. And we bring it around over the front of the ankle and up towards the top of the other side. Okay, and you can do that on both sides. So again, just above the bumpy bit on the outside of the ankle, mould the tape, not too much pull behind the Achilles, coming around, and then just back to where you started around there. And then, to finish off, we just apply a couple of these anchors again to keep the tape in place, just as we started. And you can see that this is a nice technique. Remember that we've got our fix-it tape underneath to protect the tendons at the front, and also there's a little poke there we've got at the back for the Achilles. And as you do this technique, ensure that your patient has their foot in this 90-degree angle. So if that's a bad position, just make sure the foot's always upright.